Head and neck cancer is basically any cancer that occurs in the head and neck. And so we see a large variety of different types of tumors. Starting with skin cancer, we see a lot of the more advanced skin cancers that the dermatologists may biopsy or remove, and then we are involved with doing the definitive removal of it. Sometimes certain more advanced skin cancers will involve deeper structures in the neck that need to be dealt with. So head and neck cancer could be advanced skin cancer. It could be, most people think of head and neck cancer as that occurs in the mouth, the oral cavity, the throat, which we call the pharynx, or the larynx, which is the voice box. So most people think of head and neck cancer that way, and that's usually a smoking-related problem, and we call that the aerodigestive tract cancers, and those are about 20% of cancers. A relatively small part of the pie, if you will, of all the cancers, but it's a significant one. We also deal with salivary gland tumors. We have major salivary glands that secrete saliva, and they can have tumors that we deal with. People can have tumors of the thyroid gland that we take care of. Tumors that occur near the base of the skull, for example, pituitary gland tumors, we're often helping neurosurgeons remove those. So pretty much any cancer that occurs in the head and neck we'll deal with, but the majority is the aerodigestive tract, which occurs in the mouth, the tongue, the tonsils, the pharynx, the throat, the larynx. Oftentimes that will involve deeper structures such as lymph nodes in the neck that we have to address as well as complete therapy. The thing about our surgical, we're surgeons, but we also work with medical oncologists and radiation oncologists. We have a tumor board under the auspices of the Florida Hospital Cancer Institute, where we meet regularly with those specialties and discuss patients and how we best manage them. Sometimes surgery isn't the best management for head and neck cancer, and something else is, and vice versa. So we're not taking into account, we are taking into account that other specialties are involved in, and we embrace that. And we also involve ancillary services such as speech pathology heavily in our patients, because sometimes what happens to them will affect speech and swallowing and other functions. So it's a multidisciplinary approach to this, to head and neck cancer. It's not just one treatment. It's whatever the best for the patient is used.